Anamika, she's prepared better than me.
No, it's okay. It's okay. Just give me 2 minutes.
Okay. Sorry. Yeah, I can see the pictures. Okay, this is the patient. This is not the full stem. Just neck and shoulder injuries. So actually, this hospital the injuries. The here is the thing is upper trunk injuries. Common trunk is the upper trunk. Yeah, yeah. Road traffic accident. T5 is T5 and between T6. Point at the vertebra. So there's a intervertebral foramen. I'm really very bad now, actually. So this you can show the dermatome here. You can. C5. Uh, I'm sorry, I'm not sure confident on that now. Now on. Uh, I rather do some mistakes. It's better to not to start with me because I'm not very confident with this. Just the time. Yeah. the- Yeah. Uh, yeah. Today actually I'm not prepared at all. Actually, I was hoping that someone will be just I will listen and take to be. That's the thing.
Yeah. The brachial plexus injury. Upper trunk. The tractional type of injury. C5 lateral side of the arm and C6 lateral side of the forearm and thumb. Okay. What? C6. Okay. C5, C4 and C5. Yeah. Arpal is the injury to the upper trunk, cervical 5 and 6, and it's called uh, uh, Waiter stiff deformity, and there is a motor affection. Is the arm is adducted, arm is medially rotated, forearm is extended, and forearm is pronated. And sensory affection, a loss of sensation lateral side of the arm and forearm. In case of Clampy's palsy, injury to the lower trunk, cervical 8, thoracic 1, and it's called claw hand deformity. And motor affection is the paralysis of the intrinsic muscle of the hand and paralysis of the flexor group of muscles of the wrist except flexor carpi radialis, and hyperextension of the metacarpophalangeal joint and flexion of the interphalangeal joint. And sensory affection, loss of sensation, medial side of the forearm and hand.
Excellent.
Rotator cuff muscles, supraspinatus, infraspinatus, teres minor, and subscapularis muscle. Supraspinatus muscle originated from supraspinatus fossa of the dorsal surface of the scapula, and it inserted into the greater tuberosity. And nerve supply, suprascapular nerve, and action is the external rotator of the arm and providing stability. Okay. Okay. And infraspinatus originated from the infraspinatus fossa of the dorsal surface of the scapula, and it inserted into the greater tuberosity of the humerus, and its nerve supply is the suprascapular nerve. And teres minor originated from dorsolateral part of the scapula, and it inserted into the greater tuberosity of the humerus, and nerve supply axillary nerve. And subscapularis muscle originated from the subscapularis fossa of the scapula, and it inserted into the larger tuberosity of the humerus, and its nerve supply upper and lower subscapular nerve. Deltoid muscle originated from the clavicle and lateral part of the clavicle and spine of the scapula, and it inserted into the deltoid tuberosity of the humerus, and nerve supply is the axillary nerve. Action, it has three fibers: anterior, middle, and posterior fibers. Anterior fibers causes flexion and medially rotation, and posterior fiber causes extension and lateral rotation of the arm, and middle fiber is the abduction of the shoulder joint 15 to 90 degree. Flexors of the elbow joint, biceps muscle, brachialis muscle, brachioradialis muscle, flexor carpi radialis muscle, and pronator teres muscle. And nerve supply, biceps muscle, nerve supply, musculocutaneous nerve, brachialis muscle, musculocutaneous nerve, and radial nerve, brachioradialis, radial nerve, flexor carpi radialis, median nerve, and pronator teres median nerve. It's a lateral cutaneous nerve of the forearm, branch of musculocutaneous nerve. Yeah. Uh, Actually, Dada, I read in from Sala note is the different way, but when I uh, saw this thing in your note, it's kind of different. So that's why I want to ask you, please explain me. Yeah. Okay. Antecubital fossa. So antecubital fossa over the tendon of the biceps muscle. Yeah. Mm-hmm. Okay. Okay. For the triceps, so we need to flex the elbow at 90-degree level. Then we need to tap our finger on the tendon of the triceps muscle, is posterior side. Supinator, we need to tap our finger 4 centimeter proximal from the base of the thumb. Then we can see directly the reflex of the brachioradialis muscle. This is called supinator reflex. Okay. But in Sala note, they wrote just tap finger. Okay. So ulnar nerve is the medial one-third of the dorsal and palmar aspect of the hand. And median nerve supply is the lateral two-third of the palmar surface of the hand, lateral 3.5 fingers of the palmar surface of the fingers, and dorsum of the tip of the thumb, index, and middle finger. And in case of radial nerve, posterior aspect of the forearm and lateral 3.5 fingers of the dorsal surface below the nail bed, and dorsal surface of the lateral two-third of the hand. Sensory is medial one-third of the both palmar and dorsal aspect of the hand. Rotators of scapula, upward rotator is the trapezius and serratus anterior, and downward rotators muscles are rhomboid minor, rhomboid major, levator scapulae. So trapezius originated from the occipital protuberance, ligamentum nuchae, and spinous process of the cervical 7 to T12, and it inserted into the spine of the scapula, lateral part of the clavicle. and its nerve supply is the spinal accessory nerve. And serratus anterior originated from the medial border of the ventral surface of the scapula, and it inserted into the serratus anterior originated from the uh, 1 to 9 ribs origination and inserted into the ventral surface of the medial border of the scapula, and in nerve supply is the long thoracic nerve. And rhomboid minor originated from the spinous process of the cervical 7 to thoracic 1, and it inserted into the dorsal surface of the lateral border of the scapula and nerve supply dorsal scapular nerve. And rhomboid major is originated from the spinous process of the thoracic 5, thoracic 2 to thoracic 5, and it inserted into the dorsal surface of the medial border of the scapula, and it nerve supply is the dorsal scapular nerve. And levator scapulae originated from the transverse process of the cervical 1 to cervical 4, and it inserted into the um, medial border of the scapula, superior angle, and nerve supply dorsal scapular nerve. Brachioradialis muscle in here. So nerve supply is the radial nerve and causes flexion of the forearm. Is the biceps muscle, brachialis muscle, coracobrachialis muscle. Musculocutaneous nerve, cervical 5, 6, 7. External rotators of arm, supraspinatus, infraspinatus, and teres minor. Axillary nerve supply deltoid muscle and teres minor muscle, and motor and sensory, it supply lower half of the badge area, lower end of the deltoid muscle, lower badge area, lower badge area. Okay. Abductor. Okay. Is the 0 to 15 degree supraspinatus muscle, 15 to 90 degree deltoid muscle, and above 90 degree trapezius muscle and serratus anterior muscle.
I need to practice a lot. I need to read a lot. I should relax more. Actually, I need to give more priority to reading.
If you want, you can ask me.
Yeah, it's
Yeah,
better.
other
It's better.
questions.
Please continue.
I can see. Yeah, it's the clavicle. It's the lower surface because there is a subclavius group. Medial end is the sternal end. Lateral end is the yes. It's number five. Yeah, number five.
Pond.
It's the lateral end is the number one. Yeah. Acromioclavicular joint. So spine of the scapula is the number 10 and coracoid process is the number 3 and 2 is the uh, acromion process. Number 6 is the
Medial border.
lat- lateral border. 6.
Sorry, lateral border. Sorry, sorry. What is number 8? Oh, sorry.
Is the medial border. I can't see properly.
12, 13, 15. Medial border. 1, 2.
Number 5 is the infraspinatus fossa. Supraspinatus fossa. Number 7 is okay, is the infraglenoid tubercle. Okay. So, static restraints, dynamic restraints. Static restraints are glenohumeral ligament, capsule, negative interarticular pressure, articular version, articular conformity, then glenoid labrum, and dynamic restraint, which provides multidirectional stability, and it's caused by contraction of the rotator cuff muscle. Rotator cuff muscle. Anatomical neck in here, number 3, number 10 is the surgical neck. I can't see the number. Sorry. In here, just above. Okay. Is a flexion, extension, medial rotation, lateral rotation, adduction, abduction. It's the pectoralis major muscle. Clavicular part causes flexion of the arm and sternal part causes extend the flexed arm. Adduction and medial rotation of the arm. It acts as an accessory respiratory muscle by elevating ribs. Yeah, I told it. Biceps, brachialis, pronatoris, brachioradialis, flexor carpi. Okay. Humeral head is the number 8, maybe. Glenoid number 6. Number 1. Tendon is the number 10. Is it the number 7? Supraspinatus tendon 10 and muscle. So over these things, I can't see the number actually. Okay. Number 9. Okay, I can see this number 9. Okay. So, number 5 is a deltoid. It's the glenohumeral joint and joint between scapula and ribs. Uh,
Radial nerve,
re-
uh, and the hand gives the loss of the extensor muscle.
okay, so radial nerve supply all the extensor muscles of the wrist, which gives synergistic effect for the power grip. There is radial nerve supply, there is no
There will
power
be
grip.
wrist drop. Kinda.
Medial condyle is the actually because of my camera I can't see the picture. Sorry. Zoom, but oh yeah, now I see. Is the number 7 is the medial condyle, and nerve is the ulnar nerve, and the sensory loss is the medial one third of the palmar and dorsal aspect of the hand, and motor supply
Flexor the muscles.
uh, ulnar claw hand with ulnar paradox. So carpal bone number 1 is the scaphoid, then number 2 is the lunate, and number 3 is the triquetrum, and is overlain by pisiform, and number 4 is the trapezium, number 5 is the trapezoid, and number 6 is the capitate, and number 7 is the hamate. Is the median nerve is the 21, and 31 is the ulnar artery, 29 is the superficial palmar arch, 19 is the flexor retinaculum. Four tendons of the flexor digitorum profundus, four tendons of the flexor digitorum superficialis, one tendon of flexor carpi radialis, one tendon of flexor pollicis longus, median nerve. Uh, Thumb movement flexion at metacarpophalangeal joint is the muscle is the flexor uh, flexion of the metacarpophalangeal joint is flexor pollicis brevis, and flexion of the interphalangeal joint of the thumb, flexor pollicis longus, and flexion by transpalmar adduction is the adductor pollicis and flexor pollicis brevis, and extension of the metacarpophalangeal joint of the thumb, extensor pollicis brevis, and extension of the interphalangeal joint of the thumb, extensor pollicis longus, and radial abduction. Extension by radial abduction is caused by abductor pollicis longus and extensor pollicis brevis. And adduction of the thumb is the adductor pollicis, and abduction is the thumb is by abductor pollicis longus, abductor pollicis brevis. Then opposition of thumb by opponent's pollicis, flexor pollicis brevis, and abductor pollicis brevis. Yeah. In case of flexor digitorum superficialis, we uh, we need to extend the adjacent fingers on in extended position. Then we need to ask patient to flex the examined finger. In case of flexor digitorum profundus function, so we need to fix the proximal interphalangeal joint of the examined finger. Then we need to ask patient to flex the examined finger. The scaphoid bone fracture. The avascular necrosis, malunion, non-union, delayed union. Who is the Lister tubercle? Dorsal surface of the radius. It serves as a pulley for the extensor pollicis muscle tendon, which wraps medial side and takes 45-degree turn. Flexor retinaculum attachment, proximal row, distal row. Proximal row is the scaphoid and pisiform, and distal row is the trapezium and hamate. So we need to ask patient to elevate the hand and fist the hand for 30 seconds. Then we need to occlude both ulnar artery and radial artery. Then we need to ask patient to elevate the hand and open the hand. So hand should be blanched. Then we need to release pressure from the ulnar artery. Then color should return within 7 seconds.
Okay, the picture is. Okay.
Can't see. Number 9 is the digitorum muscle, extensor digitorum. Ten is the extensor indicis. 11. Extensor pollicis brevis. Extensor pollicis longus. 5 is the extensor carpi radialis brevis 5. And 6 is the extensor carpi radialis longus. Extensor expansion of the middle and terminal phalanges of the second, third, fourth, and fifth fingers. Extensor hood is the triangular aponeurosis in the dorsum surface of the hand through which extensor muscle tendon inserted into the phalanges. Thank you. Thank you.
Means day after tomorrow we will sit again. That's the good thing. Uh, yeah. So on 21, we're going to. Sorry. So day after tomorrow we will start lower limb. Yes. Yes. Sure. Day after tomorrow. Let's say, I try my best.
It's not just study, need to speak, need to present.
There's a lot of things there. Doctor last. uh, the the thing is actually this thing is consistency. The main impact of this MRCS, like when you are consistent, your flow will come itself. So, like the thing is when before when you're consistent, these things easily come.